magbablog yung asawa ko, kaya tatanungin natin siya tungkol sa kanyang double knee replacement. Come on.
Please subscribe and hit the like button and the bell notification button. Alien is a 1979 science fiction film.
Hey!
Why do you have the operation?
Oh, okay.
Hang on.
Okay. Apparently had genetic problems with my knees, excess cartilage behind the kneecaps, things shifting around, and then eventually the cartilage disappeared. And so I was walking bone on bone, so the kneecap didn't have any cushioning. There's a lot of scraping internally. I didn't know what that was, but that's what hurt me so much. The kneecap wouldn't stay in place, and it was very painful when I would walk a little bit. I could feel scraping, especially going up and down stairs. I could actually feel things catching inside the joint. Standing and walking normally hardly bothered me at all, but as soon as I had any inclination or elevation that I had to go up, it would start catching. Upon x-rays being taken, they could see that there was nothing in there anymore, and I was now developing grooves in the bones and what they call bone spurs or bone hooks, so it was catching more and more. That's not good. And it was becoming more and more painful to the point I was wearing braces, elastic braces with stiffeners in them to keep my knees aligned and to give me support and to help the knee spring back and forth. The knees didn't want to make the legs go back and forth the way they're supposed to, so I had to wear the braces that would help keep the things in alignment, like that. Otherwise, it would just wouldn't be good at all. So after much delay, actually it involved a couple of years, I knew something was coming. On the job, I had a knee pop on me. Of course, again, like I said, this has been happening for a long time. Normally, if I had a knee get sore, I would just wear a spandex brace for a week, and then would go back to normal. So it's been something that had been building for a long time. So the surgeon said I needed to have the knee done finally. I've been asking him to do this for 4 years, but he kept putting it off. And then finally, for some reason, all of a sudden he goes, "Oh yeah, I think we should do that." And of course, the first knee went bad. So the second, I was supporting the first knee with the second leg, which basically destroyed the second leg over the course of a couple of years. And I said, well, maybe we should do both of them at the same time. The doctor said, oh, I don't do two at the same time. You just do one, then we recover, and then we'll do the other one. I went back in. I missed the doctor. The assistant was there, and I said, look, I think we should do both of them at the same time. And he said, I don't think the surgeon will like to do two at the same time. And I said, well, this one's bothering me just as much as that one is. He goes, well, let's take some fresh x-rays and we'll look at them. So before I even left, it was a matter of half an hour. The guy assistant came back with a new set of x-rays. Okay, they actually just like photocopy things. They were the actual x-rays that you hold up to the light and stuff, just things they printed off on their printer, because that's the way the technology is these days. And he goes, yeah, you should have both knees done. And I said, okay.
They changed their mind.
Yeah, they changed their mind. So the next time I went to had another appointment to meet with the surgeon, he goes, okay, so we're doing bilateral knee replacements, huh? And I said, oh, I don't even have to talk to you about it now? He goes, oh, no, I saw the new x-rays. He goes, yeah, you need both of them, and we might as well do them both at the same time. And I said, I thought you said you didn't do them. He goes, well, they're bad enough. I'll do both of them. And I said, okay. But now I was on Medicare, so there wasn't any real problem of payment for these, because I guess Medicare is very good about taking care of things like that. We went to the pre-surgery checkup, and they had another doctor. We went to the, because basically just take a bunch of vitals, blood pressure, O2 sat, that sort of thing, respirations, made sure I didn't have any problems with my lungs. And this was a different doctor altogether. This was just laying a baseline. So they have basically, because every person's a little bit different, there's generalizations of how many respirations you should have and everything, but they need to set a baseline for you in particular. So while you're laying on the table, if something varies too much, they have that baseline to compare it against and say, uh-oh, or, well, that's perfect, that's the way he usually is. Of course, they have a variation that they allow before there's a real problem, and they can take care of it while you're there, or stop the procedure if it's necessary to do so. Okay, so they sent me in for the surgery. It was hardly even knowing what was going on. They had me put the old Johnny on, and they shaved my legs. For some reason, they waited until just prior to the operation to shave my legs, pretty wide area. And before that, while at home, I had to shower and wash with a special antiseptic soap, and they wanted me to do that twice, so I did that. Then when I got it in there, that's when they shaved my legs, and they said, "Okay, so we're gonna do this, and we're gonna get you set up with your IV." They didn't really say, "Okay, now we're gonna do this, now we're gonna do that. You're gonna get drowsy." No, I was just out. I had no idea what was going on at that point. They put the IV in, and they didn't give me any incremental steps of how this thing was going to work.
Yeah.
So I was kind of disappointed in that. Basically, I got out. I woke up back in recovery, and they were keeping track of all my vitals, and said everything went really well. And my legs just had these special wrappings on them, looked like duct tape,
Yeah.
duct tape and saran wrap over the opened up areas. They look shaped kind of funny, but that's fine. I knew I've talked with other people, and I knew it was going to be pretty severe openings. Um, Within a little bit of while, they said, "Okay, we're going to take you back to your room." And after, I guess I was probably down there a couple hours, but I made out really well
Recovery
in the
room.
recovery room. Yeah, and then they sent me back to my room, and I must have been napping or something because I don't remember the actual transport going back up there.
Because you're drowsy, you're in
Yeah,
and
yeah,
out.
yeah. As I got up there, they were keeping track of my O2 sat, and would administer these big plastic balloon bags around my legs, and would be able to put ice water through those, so it would help control the swelling of my legs. And that was repeated every couple of hours during my first renewal going back into my room. So unfortunately, I have a claustrophobic personality, which can get pretty phobic, as to claustrophobia. And while I was in the preliminary recovery of that, just becoming aware, I mean, I couldn't even read anything yet. I was originally in my room all by myself, but at some point I noticed they were starting to do a procedure to the right of me. I was at the window side, and to the right of me, they started closing up curtains. And I'm going, "What's going on?" And I could hear they were bringing somebody else into my room. Okay, so now this went from a very large room to basically a cubicle, probably 8 feet wide by 10 feet wide, if that, just enough for 2 feet beyond the bed. And so I had a walker and a commode and everything else taken up all over the rest of the space that I had, and two chairs.
You could not even move around it.
No, you couldn't even walk. So if I had to do something with my walker, I couldn't even go in a straight line with
No.
my walker. I was becoming very claustrophobic. My questionnaires to the nursing staff was just saying, "Yes, we'll take care of it," but they wouldn't respond. I was very disappointed in the behavior or responses to my questions at that point. I obviously was not getting the results I needed to help control my claustrophobia, and they were not being responsive to anything else except for what they perceived as my needs physically, which even that was getting less and less. I decided I was going to have to advocate for myself. So I called a friend of mine, my pastor, who had advocated for other people. One thing I did find out, that while you're in the hospital and you're all groggy, you really need to have somebody else there, somebody who can act in your defense. I did not do that. Someone had told me to do that, and I didn't. It turns out even your spouse does not have that right. So unless you have it down on paper, there's no such thing, and they'll do whatever they think is the best decision, whether it's good or not. I had my friend come in. I told him I was having a claustrophobic attack because of the new conditions of being closed into my little cubicle. Now, they said normally you would have, if you have one knee done, you stay overnight and then you're released the next day. Okay, so I had two knees done, so I should only be 2 days there. I'm on the second day, and I'm just saying I want to leave. The hospital is not cooperating for no particular reasons. Okay, that day happened to be Thanksgiving.
Yeah,
So
and
they
I
were,
was ringing them twice.
yeah. My wife was calling. I didn't really know anything about it. We're trying to find out what's going on. They weren't really giving any information. So my friend came in, and he said, "What's going on?" I told him. I said, "I'm having a claustrophobic attack. They're not responding to my questions, and I don't know what else to do." And I know he had operated as an advocate in the past. He goes, "Okay, let me see what I can find out." So he goes out, comes back in momentarily, and says, "Okay, so they said you have to be checked out. They want to make sure physical therapy or whoever can release you." I said, "I don't care what physical therapy says. I'm here to have my knees replaced. That's done. Time to go home." And he says, "And you have to be released from orthopedics." Fine, get orthopedics up here and get me checked out. They said, "Well, you can't leave unless you can walk X amount." And so I said, "Yep, no problem." So I got out, had been practicing. I didn't like being cooped up anyway, so I did get on my walker, as crippled as I was, and I was able to take my walker out to the hallway, even when I had to go sideways because they wouldn't give me a clear path
Yeah.
to leave the room. So I had to walk my walker sideways.
The room is
They
very
they were of
crowded.
no assistance whatsoever. They would not clear me a path. For some reason, they thought this was the answer to what they wanted. But I would get myself out into the hallway. Then they even told me there was a bathroom in my room. Otherwise, I would have been using that instead of the porta potty that I had. But still, they did not give me a clear path to a bathroom in my room. I would got out to the edge of the room into the hallway, went another 20 feet to a water fountain, turned around, came all the way back into my room, which is probably over 60, 70 feet. So I had been pressing
Well,
the bell for a nurse, and my pastor looked at me and said, "Did you press the button?" I said, "Yeah." And he looked at his watch. He said, "Hmm." So he went out in the hallway to find out why nobody had been coming in, because I spent a few minutes.
nobody is answering the bell.
Yeah, nobody's answering the bell. So he went out, and the nurses were in the middle of a pizza pie out in the hallway at the nurses station, and he approached them and said, "Excuse me, did you notice there's an alarm on the room 278 down there?" "Oh yeah, we saw that." "Okay, well that means somebody needs you." "Yeah, we're going to get to that in a minute." And he goes, "No, you're going to get to that now because somebody needs you. That's why the alarm is going off. So you go now and find out what the problem is." So reluctantly they did with a big huff, and they said, "Okay, what do you want?" I said, "I want to get out." "Well, we need to have physical therapy check you out." And they had told us to the pastor, and the pastor said, "Yes, you told me that, and you said that quite some time ago, and that they were on their rounds." And they said yes, and they'll be up here when they can, and they'll say so. The pastor said, "Okay, how long?" Because we don't know. Okay, so again, half hour went by. I pressed the button again, same thing, no response. And pastor went out, find out what was going on, and he said, "Okay, what's going on? Why? Number one, why aren't you answering the bell? Number two, where is the physical therapy people that you were talking about that were making rounds?" "Oh, well, it turns out there's nobody here for physical therapy today." "Oh, really? Then why did you lie to us, saying that people were going to be here momentarily?" They didn't seem to have an answer. The head doctor that was on for that day, she came in and says, "What's the problem?" I said, "I want to get out." She says, "Okay." They said, "Well, why can't you?" I said, "That's our question. I've been trying for the last 4 hours to get our papers taken care of so we can leave." And the pastor is saying yes, and we've been ignored and lied to in the meantime. And we'd like to find out what's going on and why we can't leave. He said, "Because we are leaving." And I said, "Okay." So she said, "Okay, asked me a few questions, did a quick breaths and O2 sat and that type of thing." She said, "Okay." And then they got the orthopedic PA up there, and because they said I had to have an okay from orthopedics to leave. So they got the orthopedic guy up there. Okay, now this is 5 hours past the time they said we could leave. So the orthopedic guy, who didn't seem to know what the heck he was doing, looked at what I had for the bandages and stuff on my knees, and he goes, "Well, can you use the walker?" And I said, "Yeah." So I demonstrated again, and then I came all the way back in, past the obstacles again, back to my bed, and got myself into bed, which is quite a feat. But now I probably wasn't feeling anything because I was getting very angry and I was having my claustrophobic attack. So at that time, my pastor said, "Yes, we are leaving now. Get your papers ready because we are going." And they did so. So at that time, they finally released me and I was able to come home. The pastor brought me home and I got back home to my wife's loving care. Okay, so getting home was a wonderful thing. And I was able to sleep for some time. But then about a day into it, I started feeling uncomfortable having anxiety attacks. Not so much claustrophobia, but general anxiety attacks. I didn't feel right. Wasn't sure what it was.
You were up and down.
Yep,
I
I could not stay seated for more than 5 minutes. If I stood up, I felt better. If I sat down 5 minutes and I had to get back up, I felt like I had to keep moving back and forth. So I'd go from a bathroom back to my chair, from the chair back to my bathroom. I seemed to feel better, but I was very, very anxious. We wound up making a trip to the emergency room at 3 o'clock in the morning. The doctor said, "Oh, you're just having a little anxiety attack, so we're going to give you a shot of Benadryl."
Okay,
And
sent you home.
and sent me home. Okay, a little bit. He goes, "When you get home, take another 50 milligrams of Benadryl if you have it at home." So I did that. Never calmed down. I was never able to sit still. And
By 8 o'clock.
so this was going on, me getting up, getting down, getting up, getting down, getting up, getting down.
And no sleep at all.
And yeah, no sleep at all that entire day until 8 o'clock that morning. And actually, about 7 o'clock, I called the ambulance, 911, because they wouldn't answer really talk to you. If you call the emergency room, they won't talk to you and tell you anything. So I had to call an ambulance. The ambulance came here. He says, "Okay, well, can you walk to the gurney outside?" I said, "I can walk any way you want at this rate." And I said, "But well, wait a minute. If I get on the gurney, you're going to strap me in, right?" And he goes, "Oh yeah, that's the rules." I said,
For your safety.
"That's
it's supposed
yeah, for
to
my
be.
safety." And I understand that. However, in this frame of mind and my anxiety attacks, that was not going to happen. So, long story short, I wound up calling my brother next door. Fortunately, woke him up, signed off the ambulance. The ambulance left, and my brother came over, picked me and my wife up, and we started heading out to the hospital. Again, since I couldn't sit still for 5 minutes here, I couldn't sit still for 5 minutes in his little car. So I'd make him stop the car. I would open the door, step out of the car, get back into the car. Now this is with two brand spanking new knees. Okay, lots of surgery, lots of stitches. So I would every 5 minutes or so, I would make my brother stop the car so I could open the door, step out, and come back in. They would eventually got to the hospital. A lot of grief waiting. They couldn't give me any answers whatsoever. Fortunately, I finally had a PA that was able to help me and seem to pay attention. First time we brought all my meds and my med list with us, which got blown off by the first doctor who saw me at 3 o'clock in the morning and said, "Oh no, you got this," without really doing much of anything else, and gave me the shot. The PA that was there took a list. "Oh, you have all this. Oh, and what is the symptoms? Oh, well, we should probably do something like this." And it turned out I had some type of internal blockage that I got relief after visiting the restroom. And I said, "Look, I'm a lot better right now. I don't know how long it's going to last, but this is what we're had to do." And she said, "Oh, well, that's good." And I said, "Okay, but my mind's getting anxiety again, so we have to do something to take care of that." She said, "Oh, okay. Well, I'll send you home with this medication." And I said, "Oh, okay." And she gave me a pill while I was there, and 10 minutes I was almost straightened out. And I said, "Holy cow!
Then you go home.
I've been doing this all this time, and that's all I needed." And I figured it had to be something simple, so I was able to. At that point, I was able to go home, get more meds, and then go home
And then sleep.
and sleep.
Like
I
a
slept,
baby.
slept like a baby for 10 hours. Once I was all settled down and had to get some sleep, I very quickly got a call from home health care who came and checked everything out here and made sure I was physically able to do what I needed to do here. And they taught me some exercises to do, which was all in a book that I was supposed to be following anyway. But they made sure I didn't have any obstructions and made sure I was able to get from here to the bathroom and back, observed me walking, made sure my legs were working the way that they were supposed to. And they've done that on 3 occasions now. I've had people visit, making sure I could do it. So my wife had been helping me this entire time in case I have any problems. She was at my beck and call, which was wonderful. The home health people
Yeah.
had suggested putting hand grips here and there, and then we did get special pediments for
Chair.
the chair,
Shower
the
chair.
shower chair, a toilet riser, which this one's like this big. No, they said I would need that one because I'm having both knees done. If I only had one knee done, I would only use a shorter one. Did get that. We got that at no
From the-
cost from Maplewood Nursing Home program that they have. When we're done with it, we can return it. Clean it all up and return it, and
So
somebody else can
somebody
use it.
again.
Yeah, in this tub shower that we have. If it was just a shower, it probably would have been easier, but it was a tub shower. That's why we needed the bench. And then the ninth day,
Yesterday.
we decided it was time for the bandages to come off. The book says after 7 days from surgery, you can take the bandages off. Yes, we have video of the taking of the bandages before and after. General advice is if you're going into a hospital to do 2 knees done, probably even one knee, you have to have somebody be advocate for you at the hospital for power of attorney or whatever you need to in order to have somebody else speak for you, because they won't pay attention to you once you're in there. When you get home, if you feel funny, go back, let them know. Because I really felt I was going a little cuckoo. So I had to have somebody, I was out of my hands, I had to have somebody else take care of it. Number 3, do what the therapists tell you. Exercise and ice. The more ice you get, the better the swelling's going to be, the less swelling you're going to have, and that directly affects how much pain you can be in. We were ahead of the game. Fortunately, we thought, I said, well, we need to get the porta potty and the handrails in place on the wall so I can maneuver myself, and all these other little trinkets that we needed to have. Definitely have that all done, because if you don't have that done before you come back home,
cannot do it
you're going to be
alone.
behind the 8 ball, and you're going to be in a world of hurt, and you're going to be a real pain in the butt to somebody, because you're going to be sending them out to get all this stuff. Eat healthy, and
Drink more water.
drink a lot more water. Yeah, especially the first few days. Drinking a lot of water is very, very important. I had a lot of problem. You don't feel like drinking water. I'm not a real water drinker anyway, but I felt I only took sips of water. I should have been drinking more. However, I'm not a water drinker to begin with. Drink as much water as you can, and that helps the system. It helps flush it out, takes out any toxicity that you would have in your system, and just flushes it out, and it helps very much. As you're doing the first week, make sure you get your exercises in to minimize your scar tissue, as the therapist had said.
For the meantime, he has to stay downstairs because he isn't able to come upstairs. He has also his reclining chair, and he has a commode and simmer frame beside his bed. He has lots of medication to take, so I made a list of all his meds so I can track the time and the medication he needs to take to make sure he takes the right medication and on time of all his medication, especially for pain management.
That's it for now. Thank you.